So, Dr. Shellhass is going to talk about sleep. She is actually a member of our Medical Science Advisory Council, and she has been mentoring a young fellow named Geeta Gupta, who has been looking at sleep in LGS patients. And Geeta is actually a pulmonologist and a sleep expert. So, she's young and she's really eager. So, Dr. Shellhass is going to be presenting Geeta's work, and I'm sure she'll share it with us once she gets online. And then, Erin, thank you so much for agreeing to go after lunch. I know it's going to be a fantastic talk. So with that, there she is. Hi, Renee. Thank you for joining us. We're running behind. We're having too much fun. With that, I'm going to turn it over to you. Tell us about sleep.
Great. Thank you, Tracy. Thank you all for having me. And I'm acutely aware that you all need to go and eat. So I won't keep you any longer than necessary, but I do want to convey to you how excited I am about sleep research as a potential next step forward for LGS research. As Tracy mentioned, I am not Dr. Gupta. Geeta is a pediatric pulmonology fellow who had an extraordinarily busy week on service this week. So you get to hear from me, and I'll be talking about some of the work that we've been doing together. And some of that work has been funded by the LGS Foundation, so we're very grateful for that funding. So we're talking about sleep. Sleep is important. And it's not just me saying that sleep is important. In fact, the American Heart Association recently added sleep to its essential 8 alongside nutrition and exercise, blood pressure, and not smoking. So sleep is really, really, really important. And so it therefore should be important to us in the LGS world. Sleep problems are really common in typically developing kids who don't have epilepsy. Sleep apnea, pauses in breathing when people sleep, whether that's because of obstruction, most often that's because of big tonsils or adenoids, but there are other reasons as well, where you're trying to breathe, but the air just isn't getting in. Central, I think of as the brain sort of forgetting to take a breath when it needs to. Hypoventilation, which is gas exchange issue. Insomnia, where you just can't fall asleep, and that can be acute or chronic, and there are a lot of different reasons for it. Circadian rhythm disorders, so issues with getting to sleep at the right time, waking up at the right time, restless leg syndrome, which is exactly what it sounds like. So lots of things that happen in typical kids. So how common are sleep problems in kids with epilepsy? They're probably, they're probably about twice as common as typically developing children. And that's all comer epilepsy, not specific to LGS. I'm going to guess that if we really knew, the numbers for people with LGS would be even higher. And in fact, in this really nice systematic review that came out earlier this year, there's a nice summary statement that said although a high prevalence of problems with communication as well as sleep was observed in individuals with LGS, few studies assess these symptoms in detail. So I think that's really important. We've gotten to a point of saying, like, is there ever a problem with sleep for this particular individual? But we haven't dug in to say what kind of problem. And that's really important because the different sleep issues, many of them are very treatable, but we have to know what they are in order to get the right treatment. So, why would people with epilepsy have so much trouble with sleep? There are a lot of different reasons. The first is something that we say is called increased cortical arousal, right? There's a reason that brain is aroused and can make seizures, and for the same reasons that brain may not sleep as well as normal. Circadian rhythm disorders, you need to be able to make melatonin. There are specific genes associated with going to sleep at night and waking up during the day. Those are clock genes, and there are some overlap with epilepsy related genes. Sleep disordered breathing. So, this is again the pauses in breathing, snoring, gasping for air when you're sleeping. And that can happen because your tone is too high or too low. It can happen for other reasons as well as just not being able to clear your airway properly. Hypoventilation can happen because of tone, but a number of reasons, scoliosis and things like that. So you can't get the big deep breaths that you need. Behavioral sleep problems are numerous. I don't need to preach to you about that. One of the challenges we have is we're all worried about convulsive seizures that happen at night. We're all worried about SUDEP, and so we monitor our kids as we should. But that can generate a cycle of behavioral sleep problems as well that need to be addressed at times. And then, our medicines sometimes also mess with sleep, right? And so, certainly, there are certain medications that make it really hard for kids to sleep. There are also anti seizure medicines that make them sleep too much. And there are some that actually do help with sleep. And I'm highlighting just a few recent papers in this talk, just to kind of get us up to speed on some things that maybe we might have missed as they've come out in the last few months. Here's one by Ann Berg and colleagues, where they did a survey of caregivers of people with LGS or Dravet syndrome who had been treated with cannabidiol or Epidiolex, and they reported among the various different potential outcomes. They reported that sleep had improved when their person with epilepsy started taking cannabidiol, and perhaps not surprisingly, sleep improved the most for the people whose seizures were most improved with this medication. But half of the people who had improved seizure frequency also had improved sleep. So sometimes our medicines can help us with sleep. Well, one of the things I think is really important is the behavioral consequences of sleep disordered breathing. And, I'm a neurologist, I'm not a pulmonologist, and I'm not a sleep specialist, but I am growing to understand and respect sleep disordered breathing, sleep apnea more and more. And there's a scientific rationale and sort of a set of mechanisms that we need to start to wrap our heads around, that take us from a person who has sleep disordered breathing, central apnea, obstructive sleep apnea, who has what we call intermittent hypoxia. So every time there's a pause in breathing, there's a tiny little dip in oxygen saturation. And with that tiny little dip in oxygen saturation, there's an arousal in the brain. So just a little bit of an awakening. Doesn't mean that the person wakes all the way up, but they might, but just a little bit. And so that fragments sleep. And when you have intermittent decreased oxygen saturation and fragmented sleep, you get more inflammation, you get more autonomic dysregulation, you get endothelial dysfunction, and oxidative stress. And that affects your brain. And it affects the prefrontal cortex in particular. And that's important for cognitive and executive functioning. And what might we see this? And forgive me, I'm not an artist, so this is my best recreation of a flow chart that might explain this. But how might we see this in a person who has an intellectual or developmental disability? We might see it in for school performance, hyperactivity, inattention, behavior problems, especially externalizing behavior problems, and cognitive deficits. So behavioral consequences of sleep disordered breathing are important. There are lots of other consequences of abnormal sleep. Um, as you may probably all have experienced, insufficient sleep can provoke seizures. It has an impact on memory and learning. It also has an important impact on cardiovascular and metabolic issues, which is really important as we think of our adults with LGS, right? We're not just talking about children. Behavioral dysregulation, quality of life for the person with epilepsy and their family. And obviously, an impact on siblings. And many of our siblings will develop sleep issues as well. Oftentimes, behavioral insomnia, worry about attachment and going to sleep. Some of them, especially if they share a room with their sibling with epilepsy, may feel a responsibility to monitor their safety overnight. Things like that can impact the siblings a lot. And obviously, sleep of a person with epilepsy has important impact on their caregivers. There's a nice survey study or a qualitative study that came out a couple of months ago, where caregivers reported stress, sleep problems, anxiety related to their loved ones with LGS. I was actually surprised that it was only about a third of caregivers who emphasized sleep problems, because in my practice, it seems like it's been even more than that. So here again, recognizing I'm not an artist, but I wanted to give you a depiction of how I might think about diagnosis and treatment of sleep disorders as a breakthrough for people with epilepsy. So if we think about development and a person's development over time, especially when they're little, they learn more things and they develop over time. And so let's pretend that blue line is a healthy trajectory. Well, what if they had a sleep disorder that wasn't recognized for a bit and may have dampened their ability to grow and develop and learn normally? If we can put in a treatment for that sleep disorder, in an ideal world, we would rescue their development and they would catch up to their healthy peers. It is also certainly possible that they won't catch all the way up, but that a treatment could be initiated that would improve their development and get them to a point where maybe they have some delay, but they are better off than they would have been if the sleep disorder had not been detected or treated. And then, of course, there is a range below this, right? Where there are some times when, no matter what we do, we can't rescue development. And there's some times when we may have persistent issues or plateau. But I think this is sort of how I'm thinking about sleep and diagnosing and treating sleep as a potentially really important way that we could make a difference in people's lives. So, our hypotheses for me and Geetha and our colleagues is that effective treatment of sleep disorders could improve development and behavior and seizures and quality of life for children with epilepsy. And our overall goal is to answer questions around, could disordered sleep be a target for intervention and management of seizures and behavior in children with LGS? And how can improved diagnosis and treatment of sleep disorders make a difference in the lives of people with epilepsy and their families? So, how do we get to that breakthrough point? The first thing is we need to be able to measure sleep and sleep disorders reliably and efficiently. And this is where Dr. Gupta comes in, and she has a couple of studies where she's just starting at the ground floor to understand, how do we measure sleep reliably and efficiently for people with LGS. So it turns out there are lots and lots of different ways of measuring sleep. We can come into the hospital and do a polysomnogram. We can do actigraphy at home. We can do home sleep apnea tests. We can do wearable devices, watches, Fitbits, things like that. There are questionnaires, there are sleep logs. There are a lot of different ways to measure sleep. So, what are the ways that are the best for people with LGS? And what does best mean? Well, it needs to be acceptable to the families and to the patient. It needs to give us rigorous data, and it needs to be reliable over time. So, Geetha has two studies. The first is funded by her K 12 award, where she is enrolling 50 families with a child with LGS, and they fill out sleep questionnaires, quality of life questionnaires, seizure severity surveys, and their medication list. They're wearing a sleep tracker for up to 2 weeks, and Geetha's recruiting some of these families where the child appears to have sleep disorder breathing on their sleep tracker for a formal in-lab polysomnogram, as well as a control group of kids with LGS who do not have sleep disorder breathing as per this screening test, and then repeating their questionnaires 2 weeks later. So that's her first study, and that's ongoing. And then she has this feasibility study, which is funded by the LGS Foundation, where she is throwing every possible way of measuring sleep at a family and saying, okay, your child has LGS and you're interested in sleep. Here's the menu of options, and encouraging families to do as many of the things on the menu as possible in order to provide us with feedback about, what did they like, what was easy to do, what was hard to do, what did the kid not mind, what was the impact, all of those sorts of things, with the idea that they will help us with designing the next study to make it as useful and scientifically rigorous as possible. So families are enrolling and they have a home sleep apnea test. That's one night. They have an in-lab sleep study once. They do sleep questionnaires. They wear an Apple Watch for as long as the child can tolerate it to measure sleep-wake cycling. They have a daily sleep diary log, and they get a text message with a few questions about seizures each day. And then the families are providing feedback over time about how this is going. And we're really monitoring for how long does it take for people to give up. People are very tenacious, so they go for a long time. But also, what kind of quality of data can we collect? So far, 25 families have enrolled, 15 have completed the study already. This is since January, so we're doing pretty well. And the families have been very, very motivated to participate, and they're really going above and beyond to troubleshoot this technology when there are challenges, which is really remarkable. Importantly, the home sleep apnea test seems to be feasible for them. This is a test that is approved only for age 7 and up, but has a minimum number of measurements, and seems like it could really work and might be a great way for us to move forward. We've found that kids with LGS have been able to wear an Apple Watch to measure their sleep for days on end, which has been great. But The technology is not perfect, and the app that we are working with has been problematic. So we're still working through that, but at least we know that there's a subgroup of kids who are willing to wear that watch. So if we can find the right app, we can make this work. And then, the other thing that we need to recognize, and I'll just say out loud, is there is a nationwide crisis around sleep technicians. So when COVID hit and sleep labs were considered non-essential, many of our sleep techs were furloughed, and many of them were recruited away to EEG labs, which is great if you're an EEGer, but is a real problem now because they got used to working day shifts and they're not willing to come back so much to work overnight. So across the country, there's been a real problem with getting scheduled in-lab polysomnograms, and that has impacted our study as well. So just to wrap up, I really feel like having spent a lot of time caring and loving my families with LGS, it is time for you to have a breakthrough. You deserve it. And I really do think that concerted efforts to study and improve sleep may be the most achievable near-term breakthrough that we have for LGS. Getting our hands around sleep can help with behavior, it can help with seizures, it can help with quality of life. So the first step is figuring out how to measure it, but then the next step are really doing this on a broad scale and figuring out the right interventions for the right kid at the right time. And I really think that that's going to help us move forward. So, with thanks to Dr. Gupta and to all of you, I would be very happy to answer a question or two if you like before you head off to lunch, and I will not take it personally if you need to go and eat. Thank you.
Thank you so much. I don't know if you can hear, but you're getting quite an applause. I know this is a major area of research for the foundation. And if you guys have any questions, please email them or put them in the online chat. And Renee, we will send them your way so you can respond to them. And thank you so much. We really appreciate it.